amesu eyekuwaisha eyi mubanda na kukenganangashi twakekala edi twakakwila hamu muchima wami wakenyeshei mulonga amesu eyekuwaisha nangashi twakekala edi twakakwila hamu muchima wami wankenyeshei mulonga amesu yeyikuwaisha eyi mubanda nakukenga nangashi twakekala edi twakakwila hamu muchima wami wankenyeshei mulonga amesu yeyekuwaisha odi wami eye wowo wakenyeshei eye wowo enjabi yami wakenyeshei eye wowo enjabi yami eye wo Zambia tulemweba ukutila muno chalo tulekwaya byo muchinshi kumitundu yonse chino chalo cha Zambia chachikwaya kapatulula umuntu ngali muno chalo nishemwe na Zambia wewe na Zambia tulemweba ukutila muno chalo tulekwaya byo muchinshi kumitundu yonse chino chalo cha Zambia chachikwaya kapatulula umuntu ngali muno chalo nishemwe na Zambia Zambia tulemweba kutila muno chalo tulekwaya byo muchinshi kumitundu yonse chino chalo cha Zambia chachikwaya kapatulula umuntu ngali muno chalo nishemwe na Zambia. One Zambia, one nation. one nation.
Nangwa pite, nangwa bute.
New one Zambia, one nation.
Yellow, green, black and white.
New one Zambia, one nation.
Nangwa pite, nangwa bute.
New one Zambia, one nation.
Yellow, green, black and white.
New one Zambia, one nation.
Nangwa pite, nangwa bute.
New one Zambia, one nation.
Yellow, green, black and white.
One Zambia, one nation.
Kibukwe mutamu ndi buyanje. Kibukwe mutamu ndi buyanje. Yawulire tebulu mubonde. Yawulire tebulu mubonde. Wakasongola peji kanyola. Wakasongola peji kanyola. Wamuletane mwanji muzugo. Wamuletane mwanji muzugo. Chula bashiye wa mulume. Chula bashiye wa mulume. Aweye mwasongola ninga yamu. Aweye mwasongola ninga yamu. Bamubonde pako ya kunchito. Bamubonde pako ya kunchito. Washara watwera munzugo. Washara watwera munzugo. Nanchi mukambwe wawa mkaji. Nanchi mukambwe wawa mkaji. Bamubonde pakufuma kunchito. Bamubonde pakufuma kunchito. Mwawera iba bukwe babukwe. Mwawera iba bukwe babukwe. Nanchi mukwabo biyorora. Nanchi mukwabo biyorora. Kibukwe cha mtauni buyanje. Mama, 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 baba we, baba we, mama, akakabu we, akakaki.
A very warm welcome to you and thank you for joining the WHO NTD department on this webinar organized in collaboration with the NTD Supply Chain Forum. As usual, we have expert panelists who will talk us through this vital component that has the task of delivering quality assured healthcare products and services to over 1 billion people annually. The coordination and efficiency required is both complex and enormous, as you will get to hear during the discussion from professionals working in supply chain. And these include pharmaceuticals producing medicines, shipping, forwarding, in-country distribution and product management, precise reporting structures with facts, figures, balances, and requests. They'll share insights into best practices and possible solutions to the challenges that exist and those that are anticipated. So as we move towards the NTD 2030 roadmap targets and of course the SDGs. So we're hoping for a spirited webinar and look forward to your questions during the Q&A session. Kindly ensure that you use the Slido app to submit your questions for panelists, which we will endeavor to address, time constraints notwithstanding, but details are on your screen now. I'd like to thank the interpreters as well. Translation is available in French, Spanish, and Portuguese. Look to the bottom of your Zoom screen to activate. Social media hashtags to use are hashtag NTD Roadmap 2030, beat NTDs, and remember to tag at WHO as well. Panelists, just a quick reminder that during your segment, kindly keep your camera on, but remain on mute until it's your time to share your insights. And I'd also like to point out that the webinar is being live streamed and will be available to view online after the event. I'm Patricia Mira, your moderator, and without further ado, let's hear some introductory remarks from the Acting Director of WHO's Department of Control of NTDs, Gautam Biswas. A very warm welcome to you.
Thank you, Patricia. Good morning, good afternoon, and good evening to all of you. On behalf of Dr. Umali Malachela, who unfortunately could not be here today, I would like to warmly welcome all of you to this webinar. As you know, this is part of a series of webinars that we at WHO NTD have been organizing, sometimes with our partners, around the new neglected tropical diseases roadmap, which was launched early this year, and it encapsulates the goals and targets set for the 2030 Sustainable Development Goals. The roadmap was developed through a very consultative process with countries, stakeholders, and partners, including the pharmaceutical industry, academia, disease-specific experts, non-governmental organizations, and even youth organizations. During the consultative process, 4 areas appeared as the most commonly occurring gaps, which were the impediments, potential impediments to reaching the 2030 targets. And one of them was access and logistics. Now, great progress has been made in the implementing of NTD services. As you know, before the pandemic hit us in 2020, annually over 1 billion people were treated either for preventive or curative measures against at least one NTD between 2015 and 2019. And this could be only possible thanks to the pharmaceutical partners making the medicines available in good quality and quantity, and their delivery from global to local levels with the support of the national ministries of health, their health infrastructure, health workers, and sometimes supported by implementing partners. A number of lessons have been learned during the course of the past decade, and accordingly, shifts have been proposed in the new roadmap. For successful delivery of effective services, where they're needed, timely availability of quality and affordable medicines and health products is essential at the point of care or distribution. In order to better support the new roadmap, the department reorganized its resources with the creation of a unit on strategic operations. So this unit focuses on ensuring an effective supply chain management of medicines and health products in coordination with the pharmaceutical industry and other partners. I hope this webinar will be both informative and thought-provoking on how we can ensure that the medicines and health products reach those who need it most in good quality and in good time and adequate quantity. Thank you. Over to you, Patricia.
Thank you very much for giving us a snapshot of the state of play, Gautam. But before we begin, a brief reminder of why we do what we do. Ambitious NTD roadmap targets that highlight as a priority area the accessibility to quality assured NTD health products and efficient supply chain management. So let's pivot to the discussion, beginning with a few key points in the first mile. Speaking to this, we have Afewerk Tekle. the head of Strategic Operations Unit in the Department of Control of Neglected Tropical Diseases at WHO headquarters. Joining Afterwork is Ms. Tiana Williams, the Director of the Albendazole Donation Programs, I had to make sure I said that properly, at GlaxoSmithKline. Also with them is Cassandra Holloway, the Project Support Specialist at the Task Force for Global Health in the US, and Fatima Ait Bendawad, the head of DHL Global Humanitarian Logistics Competency Center in the UAE. Okay, Afterwork, we'll start with you. You lead the NTD supply chain operations. How have you managed to provide a continuous supply of NTD health products over the years?
Thank you very much, Patricia, and welcome everyone for this webinar. The successful NTD program always depend on availability of good quality medicine and compliance to bring impact on morbidity and transmission, and you need also to have a good information system and accountability which related to recording and reporting. So WHO over the years has been managing a number of health products, at least for 13 NTD diseases or disease groups, and around 30 types of health products, which include medicine, diagnostic, and other supplies. So we have a formal MOU agreement from a number of 11 pharmaceutical donors, generously donating on average every year around 2.3 billion tablets. The peak in 2018 was around 3 billion tablets, which is a big amount of operation. So in the last 10 years, we have around 20 billion health products donated generously and supplied to countries. And WHO managed around 96% of all this donation, apart from 2 products which are managed outside WHO coordination. So this every year on average related to 1.5 billion treatment delivered to the people in need. So our main objective in our program in supplying this is countries will apply for donated medicine or procurement, then they receive and distributed and reporting properly on how they use rationally the medicines. Mm-hmm. So we work very closely with member states, pharmaceutical donors, financial donors, implementing partners, and WHO at different levels. So at regional level and country level. So how we manage this is, partnership is key, and good communication and intensive follow-up of all the shipment and donation that we give to the countries, and closely working in partnership with all stakeholders and with good communication and having a very good database on following up on each country has helped us very much in achieving this continuous supply of medicine for the last almost probably more than 3 decades.
Fantastic.
Thank you.
But taking the impact of the ongoing pandemic into consideration, has your unit had to change, or perhaps should I ask, how has your unit had to change in the way that it functions?
Okay, when the pandemic started in February or March 2000, WHO was just finishing the big transformation agenda, and a new unit was created within the NTD department to oversee all the operations, including the supply chain management of the medicine together in a unified and integrated approach. So we were starting this new structure, and at the same time, the COVID pandemic kicked in. So it was very challenging because we have to use different platforms to work from home, and communication at the beginning was not easy, and the uncertainties was very high. But slowly we were able to adapt with a small team, but very efficient, and we were very closely working with the different stakeholders with the production or the shipment, on the delivery and distribution of the medicine and all the consumable at large. So we changed the frequency of our engagement with pharmaceutical donors, almost having a weekly meeting on each shipment, on each medicine donation, on how their production planning is, and so on and so forth. Also, we very closely work with the regional offices and country offices to address issues related to inventory management, monitoring of any expiry medicine, particularly for those medicine which have a very short shelf life. So with this close follow-up and the challenges, we adapted to a new working environment, and we were able to deliver those products. Of course, there are some problems at the beginning, but later on, we were adapted and we were able to function as much as possible as the normal times. But normally, this situation is very, very challenging.
Yeah, but still, and to the team's credit, in spite of the disruption, you managed to deliver more than 1.6 billion tablets and health products in 2020. That being the first year of the pandemic, it must have been incredibly challenging.
Yes, indeed, it was very challenging. Probably the NTD supply chain management cycle, which has got a number of challenging, that as you can see here, this cycle has to start from somewhere and needs to complete until, countries report back to WHO on their utilization. So there was a challenge at the beginning, particularly in the manufacturing area, because, when at the beginning, when this happened, the manufacturing was affected on two ways. One was related to getting API, which is a raw product for production, because India and China was the major supplier for that one. Then manufacturing was also affected because of shutdown and minimizing human resource. There are other factors related to manufacturing, challenges related to shipping, and transportation was also affected. The lockdown measure has really affected a number of chains that you see and the challenges that has been pointed out. And this normally is very much constrained before, and with COVID, it was much affected throughout the cycle. Thank you.
Yeah, thank you. Let's get a picture from pharma, given that you've just been talking about manufacturing. Tiana, you are the current chair of the Supply Chain Forum, a platform that's composed of pharmaceutical donors, forwarders, implementing partners, donors, and of course, WHO. It's been called one of the boldest public health initiatives. Now, briefly talk us through the best practices that you have devised to facilitate the work of this platform.
Thank you so much, Patricia. Thanks, everyone. It's really a pleasure to be with you today. Certainly, in addition to all of our individual contributions from the private sector, we identified that really this space is very unique. It's a place where we can all work together across a number of different areas and partners to really deliver massive global health impact. And as a result, in 2012, we together formed what we call the Supply Chain Forum. It started off with 4 people. Today it's more than 40, so it certainly has grown in size and volume and impact. And there are a number of things we have really worked hard on to improve, starting with delivery door to door, which was an extension from door to port, so to all the countries for a number of pharma partners. It's also, working with DHL, and Fatima will tell you a little bit more about the DHL Control Tower, which we moved from a more commercial model into a aid and relief model, benefiting us and the programs significantly. We've developed a tool called NTD Deliver, which actually brings everybody together to capture and track and have visibility of all the supply chain data that we can possibly work on. To improve our processes. We've developed certain SOPs over the years, including advocacy, training, and other bits and pieces that have evolved as part of this big group. But I think Afewak really nailed it when he said this is all about partnership. And as much as one of us can have an impact together, we can have a massive impact, in particularly where our medicines are co-administered for similar diseases. So it's been a real pleasure, and certainly the pandemic has challenged us a lot. Yes. In our expertise, capabilities, resources in all aspects of supply chain.
Growth is good. As a representative of one of the farmer donors, what are the challenges and the best practices, of course, in delivering millions of tablets to countries working with WHO?
So, Patricia, you have frozen for me there. I don't know if it was just me, but I think you asked me about the challenges.
That's correct. That's correct.
Yeah. Okay.
It could have been me.
It was on purpose, surely. No. So challenges. I mean, absolutely. Look, we've never been in a place where we are today with the pandemic. As Afewak showed, there's a cycle of events that need to happen over a period of time for us to be able to continue to deliver the medicines to countries, and of course for those medicines to be utilized across the globe where they're needed. From API supply to distribution logistics to import-export requirements, all of these things have experienced delays and difficulties. But also for us in particular, demand planning. Of course, everyone's resources are now pulled in all directions with the COVID response. Therefore, that means we are competing for resources and everything else, not just within our companies, but also on the ground. So working out what is needed, how much is needed, and when is being really, really difficult. And as Afewak mentioned, inventory management, also figuring out how much is left in each of the countries on all levels has been also particularly challenging. But again, without the partnerships and working with the WHO colleagues, with partners, with regional offices, it would be impossible. And yet we're making strides. We're trying to extend our technical capabilities. We're trying to extend system support. We're working really closely together to try to minimize any negative impact and to continue to supply despite all of these difficulties. We continue to support and supply countries who apply for their medicines. And we hope that next year will be a better year and we'll return back to normality of some sort.
Of some sort, yes. But it sounds like it's daily problem solving and of course strengthening links. Cassandra, you handle the platform that coordinates activities of the NTD Health Product Supply Chain Forum. We also heard you have a tracking tool called NTD Deliver, which I think is a fab name. Talk us through this tool. How does it work?
Well, first, thank you so much for having me at this meeting. I really appreciate having the opportunity to share about NTD Deliver. The tracking of NTD Deliver, it's important to know that the tracking tool is available to anyone. This tool is an open source website. It's located at www.ntdeliver.com. Yes, NTD Deliver tracks medicine from the receipt of the purchase order from WHO or other donating bodies, such as ITI, to the delivery of the medicine to the country's port or to their national medical store, depending on the donation.
Wow.
When you go to the website, you click on select a country under country summary to track the order from the country you're interested in. Currently, the ministries of health and their partners use this system to track the medicines of GSK's albendazole for LF and SDH, Eisai's DEC for LF, Johnson & Johnson's mebendazole for SDH, Merck's praziquantel for schistosomiasis, and we also have information on the Pfizer Zithromax for tracking for trachoma. But there's even more information if you click on the link within our system that takes you to the ITI Zithromax tracker that holds more information. And it's good to note that currently we have 32 ministries of health that subscribe to our tracking emails. And this doesn't even include the many, many additional people that track using the website. I hope that's helpful.
Yeah, gosh, we've got to get more on there of the ministries of health. Now, in terms of benefit, it must be huge, when it comes to monitoring your activities.
Of course, its clear-cut benefit is, of course, the visibility and the ability to coordinate shipments across stakeholders. So if I'm working with an individual in the country or even a regional WHO office, we can work together and see exactly where that source of medicine is. So if you receive the medicines to the port, the national medical store, or you even manage the in-country supply chain, or even conduct the MDA, this access is vital to know where that medicine is for the first step.
Yeah. Wow, thank you very much for that. And we're only halfway through the first mile supply chain cycle that Afewerk, showed us before in his slide. Now, shipping tons of medicines requires all the logistical attention in the world. Fatima, given that you have vast experience handling health products to multiple countries, what do you do to ensure that these donated medicines reach the countries in time? If you could unmute yourself.
Thank you so much.
Then we can hear all your wonderful insights. Thanks, Fatima.
Thank you so much. We do work with the with WHO as well as the donors from the time that the purchase order is received for a particular country. So we work together in terms of packaging from the packing stage, because some of the countries require smaller packages because of the type of aircraft or the smaller size aircraft in certain islands. So from there we go ahead and work with the country offices of the WHO in terms of getting the tax exemptions already of the shipments prior to moving the cargo. So it is important as well that working closely with the partners on WHO, making sure that we are delivering the medicine to the central medical stores a time ahead of the MDA dates. And based on that, of course, we ensure that we're using the best mode of transportation, the fastest based on the urgency or the time that we have available for the delivery, or sometimes based on the recommendation of the WHO. We ensure that all the paperwork are ready, and we work on with our partners in terms of airlines and shipping lines to ensure that we have the necessary bookings and moving the shipments. While along, of course, the movement of the shipments up till the countries, there is always tracking and update of the shipments. This is what Cassandra has spoken about in the NTD. So there is an API link between DHL system called FCM with the NTD, where information about each individual shipment is passed through the NTD, so the NTD partners can have access and visibility to whereabouts of the shipment. It is, of course, it is coordination between all partners, so that at the end, the most important thing is that we ensure that the deliveries are done ahead of the MDA day to ensure that the pharmaceuticals are in country to be able to get them in the final, all the last mile district stores where the MDA days will take place.
Yeah. And very quickly, I mean, since the start of this pandemic, what have been some of the persistent and new challenges that you've faced?
There are a lot. There are a lot, and unfortunately, some are still there. Of course, I mean, when the pandemic started, and many of the airlines have stopped or reduce drastically their flights into many countries. Unfortunately, the countries where we are delivering to, we say mainly Africa, has been impacted drastically by the pandemic. The challenge was that Africa was completely cut from the rest of the world. There is before the pandemic, very few flights, and coming to the pandemic, there was a huge decline in the number of flights going to each country. So this has really affected the deliveries and the solutions to deliver to these countries, which is the majority of the receiving countries are in Africa.
Yeah.
So then we have to find solutions in between that. We have to be creative, and I would say finding multiple mode of transportation, be able to reach the final destination. Of course, the challenges as well came in with the borders and the trucks and the challenges with the testing of the drivers to cross the borders, and that as well led to a delay in getting the deliveries. But as you mentioned, 1.6 billion tablets have been donated, so we managed to get it there. Some challenges still continuing. I mean, with the pandemic, the entire supply chain has been disrupted. There is a huge scarcity of space on vessels, on equipment, on the origins, and as well as in terms of space on aircraft to reach the final destination. And this is, of course, there is congestion because of the slow productivity on the ports. Many ports had to work with half of their staff. So all these has led to the disruption of the NTD delivery. So it's still, we are able to reach there and be able to deliver, but of course have impacted the fast delivery that we knew. Adding to that, of course, the costs that have increased drastically for the transportation impacted as well the donors who have been contributing a lot, both to cover the cost of the medicine as well as the shipping cost that has increased by 300%. And continue to increase, unfortunately, and that means that there is more need of donations to support the NTD efforts and be able to deliver the medicine to the ministries of health in countries.
I'm going to stop you there, Fatma. I know that you could tell us a lot more and we could have a great discussion around this. Let's take a few questions, though, from the audience. And of course, you've been talking about some of the stuff that's been happening in country. And here's a question for both Afewerk and Tiana. What are some of the efforts that WHO and partners are working on to improve supply chain management at country level?
Thanks, Patricia. Afewerk, did you want to take that?
Tiana,
yes.
Go ahead. I'm sure.
Okay. Why didn't?
Go ahead.
For me, I mean, sure. So obviously, a lot of the efforts that pharma put forward have been focused on what we call the first mile. But in the last mile, there have been a number of pilots for us to address, to extend the technology and the developments that we have made over the years into the last mile, so that can be utilized by the countries themselves, creating more visibility and tracking that inventory and utilization. We have also produced a number of very focused SOPs within the group that are now being shared with countries as best practices for every part of the supply chain. And I'm sure that on a local level, through ESPN and other regional offices, my colleagues are doing a huge amount of work to improve the supply chain in the last mile too. Afewerk, I don't know if you want to add anything.
Yes. Okay. Thank you very much, Tiana, for that. We have a number of efforts that we are trying to address, particularly challenges related to the last mile, which is a huge challenge we have in countries. So capacity building is one effort that we are doing. So there are a number of SOPs, standard operating procedures, on specific bottleneck areas that you see on the supply chain cycle. So these are already now going to be available very soon, will be launched early next year. But at the same time, also we are developing in partnership with partners, FCDO, a training course in Open WHO, which will be launched probably this week, where people can go there and get training on supply chain management issues and the normal standard procedure that they should take. And also we are developing a mobile app to be used at CDDs or the volunteers that distribute the medicine, the health workers, and it will be very easy to get all the standard operating procedure that we have produced in their phone to just cross-check.
Super, super. Okay, a question for you, Cassandra. Is there any possibility for NT Deliver to manage demand/requests for new NTD medicines other than currently donated medicine in the future?
We can always expand the system to include other donations or other medicines, but we would need the organization to reach out to us and make that request. Currently, we do think that the leprosy drugs may be incorporated into NT Deliver, but we're still in the process of reviewing exactly what the needs are of Novartis.
Okay. Thank you very much to our panelists and of course the audience for your contributions. Before our next panel joins us, a brief visual break with a focus on the NTD supply chain program. Back shortly. And of course, accelerating programmatic action includes solid strategy and a well-coordinated, integrated supply chain system for effective service delivery. No small feat, I tell you. Over to our next group of experts, talking to elements within the last mile. And as in the first panel, the slide showing the cycle will pop up on your screen at intervals to give you a glimpse of some of the main issues with a spotlight on in-country management. With us are Modest Tezembong, who's a supply chain management officer at WHO Afro. We have Boubacar Diop, who's a pharmacist, logistician, and coordinator in the Ministry of Health in Senegal. Sultani Matendechero, who's the head of the National Public Health Institute, Kenya CDC here in Nairobi. Mao Fall, who's the chief of party at USAID's Act to End NTD's East program at RTI International based in Mozambique. Okay, it's great to have you all join us. Modest, let's begin with you. Countries in WHO's African region are recipients of much of the donated medicines, and many have customs and other procedures that can potentially delay the delivery of these commodities. What measures have you taken or put in place to make this process easier?
Okay, thank you very much, Amira. As you may know, the ESPEN project objective number 3 is to ensure equitable access to quality assured neglected tropical disease medicine and making effective use of the donations through efficient supply chain management. So over the years, we have seen several countries with new regulations, import permit requirements, tax exemptions, pre-shipment inspections, additional tax and fees that are not covered by exemption certificates, exemption certificate. Mm-hmm. So these make the process very lengthy and also causing unavailability of drugs at the planned master administration campaign dates. And also we know that this can compromise the quality of the drugs during the transit time at the port of entry. So our aim has been to see how we can put strategies in place to reduce lead time for green light requests, tax exemptions, custom clearance, import permit, and increasing agility and efficiency during these processes in the context of the COVID-19 pandemic, as well as operating in very changing environments. So the action that we have taken at the regional level, at the ESPEN, included conducting mapping of the customs issues, jointly with headquarters and WHO country offices. And ESPEN has also been enhancing advocacy with respective national authorities and central medical store to carry out necessary preparatory works for the importation of medicine and facilitating discussions with relevant stakeholders, including Minister of Health, just like I said, and also helping them to have real-time monitoring of the supply chain operations. Another thing we have done, just like other panels member already said, it was about SOPs. There are 2 SOPs that are the one focusing on the shipping green light, the shipping notification and green light, and the second one is on the custom clearance and delivery process. So these SOPs are currently at the final stage WHO clearance process and will be made available. And we even had the opportunity to brief countries on this SOP in the middle of 2020. So another thing which we have done, another action included increasing communications and coordination between WHO, country focal points, pharmaceutical companies, freight forwarders, and also central medical store focal points. And ELSPEN has used the WHO regional director leadership to call for awareness of WHO country office representative to work with national ministry of health to improve this, ensuring that there is appropriate funding to pay or to manage the taxes and fees that are not covered by this exemption certificate. We have also partnered with Uniting to Combat Neglected Tropical Disease, the African Leader Malaria Alliance, and other organizations like International Trachoma Initiative and the Mexican Donation Program, working hand in hand to make sure that those challenges, custom challenges, are managed. So ESPEN relies on commitment of recipient countries to remove barriers, custom barriers, or to anticipate and budget for this in case there are not exemptions, to ensure free flow of the donated medicine in the African region, to ensure that we achieve the WHO 2030 roadmap objectives.
Yeah, that's right. That challenges are certainly inevitable. But what is your next priority? Very quickly, because we'd like to leave some time for questions at the end. What is your next priority to make the supply chain even more fluid?
Yes, thank you very much for the question. My priority, our priority as ESPEN is to build a proactive, responsive, and well-resourced supply chain management system in the African region for an Africa free of neglected tropical disease. And I think partnerships, just like we said, partnerships, communication, transparency, and accountability, and commitment of different actors are really needed for this. Thanks.
Great, we're looking forward to that. It's also great to have some input from a country, one of the countries that has been rated as one of the best in terms of performance in managing the delivery of health products, and that's Senegal. Boubacar is a logistician and coordinator in the Ministry of Health in your home country. What is it that works best for you? If you could turn your mic on, that would be great.
Merci.
Okay.
Merci d'avoir donné la parole au Sénégal pour partager l'expérience dans le cadre de la gestion des médicaments MTN. Effectivement, le processus a démarré avec 2 évaluations menées en 2016 et en 2018 avec l'OMS et notamment l'USAID. Donc, à partir de ces évaluations, on a identifié les défis et des solutions ont été proposées dans chaque domaine de la chaîne d'approvisionnement. Et on a commencé d'abord par l'élaboration de procédures, parce que pour une meilleure gestion des médicaments, il faut des documents, il faut des outils, mais il faut des procédures harmonisées à tous les niveaux, du niveau central au niveau périphérique. Et de manière spécifique, ce qu'on a fait en termes de quantification, ce qui a été proposé, c'est la mise en place d'un comité technique qui est chargé du remplissage de ces formulaires OMS. Dans les délais requis. Et on utilise les populations officielles du système sanitaires pour avoir une meilleure visibilité. Donc, l'autre défi, c'était en rapport aussi avec la coordination.
Are you picking him up now? Are you picking up
la coordination et le personnel qui est utilisé. Et pour cet aspect, oui, donc pour cet aspect de coordination, donc il y a les autorités qui sont, il y a les autorités de réglementation telles que la direction de la pharmacie et des médicaments qui est chargée de tout ce qui est importation. Donc, ils sont conviés à nos réunions de coordination et avec eux, ça fait un peu l'importation des médicaments. L'autre aspect, c'est la gestion intégrée des médicaments. Les produits MTN, ce pas des produits isolés et sont intégrés au légal.
Boubacar?
Oui, Patricia?
Sorry to interrupt you. We're having some problems with your sound. So, of course, even the translators aren't able to translate. It keeps coming in and out. Perhaps you could check that and we could come back to you, okay? And I'll just move over to Sultani. I'll come back to you, Boubacar. Sultani, it must be said, each country will have challenges that are specific to it. You have years of experience in this field in your former role as an NTD program manager. Tell us about some of the challenges you faced here in Kenya.
Yeah, so thank you, Patricia. I think when we talk about access to NTD medicines, it is one of the areas that is closest to my heart because, my background as a pharmacist actually makes that one of my strong points.
Yeah.
However, we have experienced a very interesting problem in Kenya. I had the privilege of, overseeing the establishment of one of the most robust and, effective programs in terms of elimination. But right now, as we speak, we are actually facing a lot of challenges in terms of availability of the medicines that we need to use to be able to achieve the same elimination. And this has been a problem that has been coming along for quite some time because of a very interesting coordination problem. So you find that we have the NTD program, which is interested in eliminating the NTDs and also achieving sustainable control in areas where elimination is not feasible. But then we have other programs which are also targeting the same products, but maybe for different outcomes. For example, improving attendance of school children in schools, or even improving performance. So the World Health Organization has graciously provided donations to us, which are actually sufficient to be able to help us with our elimination goal. But we have experienced a situation where there is a dichotomy in the country. There is a, a managed kind of challenge where we are fighting for these donations with the other programs, so that at the end of the day, we are unable to report to WHO because, when they give us the medicines, then we have to report before we can now be given new batches of the donation. So we have been seeing a situation where because of these internal difficulties, we are unable to report. And so we are unable to get the medicines that we require. Now, this just counts to a breakdown in the pharmaceutical management cycle, where now you find that, yes, we have requested for the medicines, we have received them, but when they get in country, now they get diverted to uses that are other than what was intended, Patricia.
Yes, Sultani, I mean, you mentioned about the schools, and that is a positive thing. Do you think where's the room for improvement? What can happen? Do you think this has improved in any way in terms of all the other, issues that have been faced in Kenya?
So that's a very good question, Patricia. Actually, it has been deteriorating over time. You realize that in Kenya, we have run one of the most successful lymphatic filariasis elimination programs, and we are at the tail end of elimination. But just when we are about to deliver the last round, we find that we have run out of albendazole. By the way, WHO has really supported us in terms of trying to bridge the gap, sometimes understanding, even GSK coming in to give us additional doses of medicines so that we can bridge the gaps. But right now, we are unable to conduct our final MDA because the school health program came and took the medicines that we were supposed to use for lymphatic filariasis and went and used it for STH in school children. So you find that it has been deteriorating. But as a government, because these are also government programs,
yes,
we are able to resolve these problems. It is only that there is external interference because we are seeing some toxic partnerships coming in, so that you find some partners going and now insisting, trying to tell the other programs, no, this one, let's just continue supporting you to implement this program, and then it creates a problem. So I think this is an issue that really needs a lot of attention, and not just country-specific attention. It needs global attention. So we need a concerted effort. If we are to meet the 2030 WHO roadmap goals for elimination and sustainable control, then such an issue, because when you don't have the medicines, then you cannot be able to achieve anything. So it is something that needs concerted effort so that we can address it. And then we try to address some of these, quote unquote support that comes in to now destroy coordination needs to be checked even from outside of the country. Patricia, thank you.
Thank you very much for that, Sultani. Mao, you lead RTI International Supply Chain Projects in Mozambique. What is being done to improve delivery of NTD medicines to remote health facilities? You've just heard Sultani talk about some of the issues in Kenya. What's happening in Mozambique?
Merci beaucoup, Patricia, pour cette question qui est pertinente. Nous commencerons d'abord par magnifier l'excellente collaboration que nous avons avec le ministère de la Santé à travers le projet USAID Act East. Acheminer les médicaments dans les sites éloignés au Mozambique est un grand défi. Comme vous le savez, le Mozambique, de par sa superficie, est immense, parsemé par des cours d'eau, des routes accidentées, une plénitude d'îlots. Et vous avez également une pluviométrie qui est assez abondante. Donc, en collaboration avec les équipes de district, les équipes des provinces, dans un premier temps, nous avons revu tout ce qui est planification. Donc, nous devons, tout ce qui est planification, ça veut dire quoi? C'est-à-dire qu'il faut donner beaucoup plus de temps, en fait, aux responsables des médicaments, à tous les responsables, de prendre le temps d'aller au niveau des différents districts et au niveau des sites éloignés. Ça veut dire quoi? Concrètement, on demande à avoir les médicaments sur place 3 semaines avant, 1 mois ou plus. Au moins, ça permet d'acheminer les sites qui sont un peu éloignés. Un autre point qui est fondamental, c'est vraiment de faire l'inventaire de la logistique. Ça veut dire quoi? Voir il y a combien de voitures, combien de bateaux, combien de bus, combien de trucks. Parce qu'il ne faut pas attendre le dernier moment. Il faut quand même avoir cette information bien avant d'aller au niveau du terrain. Donc, comme autre point, je pense que ça, c'est tout à fait logique. Je pense que la planification doit se faire avec les responsables des médicaments à tous les niveaux. Et il faudra une très bonne coordination, que ce soit par téléphone, par email. Comme vous savez, parfois, il y a des sites qui n'ont pas Internet. Un point sur lequel on ne pense pas trop souvent, c'est la pluviométrie. Donc, le Mozambique est un pays où quand même il pleut assez abondamment. Et lorsqu'il y a des pluies, il y a certains sites qui sont inaccessibles, ce qui fait que l'acheminement de ces médicaments au niveau des sites pose un très grand problème. Donc, voilà concrètement ce que je pourrais partager avec vous par rapport au premier point.
Yeah, well, climate is certainly going to be something that we all have to consider. But part of your project involves building capacity for data collection and the use of data for decision making. How important is this to you, Mao?
Écoutez, aujourd'hui, on parle beaucoup d'élimination, de contrôle. Et je pense que c'est des éléments qui ne peuvent pas se faire sans une très bonne qualité des données. Donc, on veut être à l'aise. On veut être à l'aise avec les couvertures qu'on a, on veut être à l'aise avec les rapports, on veut être à l'aise avec tout. Donc, en dehors, en fait, de la collecte classique des données lors des campagnes, nous déployons beaucoup d'énergie, en fait, dans tout ce qui est qualité de données. Par exemple, lors des supervisions des campagnes, nous utilisons un outil qu'on apprécie bien, c'est le DQS. C'est un outil, en fait, simplifié du Data Quality Assessment qui permet de faire la vérification des données au cours des supervisions. Donc, toujours au cours des campagnes, de façon systématique, maintenant, on essaie de faire un maximum d'enquêtes de couverture pour qu'on soit à l'aise avec les couvertures qui sont reportées. Nous avons mis en place, avec l'équipe du ministère de la Santé, un comité de suivi-évaluation qui permet de revoir les données et qui permet vraiment d'être à l'aise. Donc, je veux vraiment dire que lorsqu'on parle d'élimination, lorsqu'on parle de contrôle, on veut être à l'aise. Donc, important d'avoir une qualité des données. Donc, je terminerai juste par dire qu'il y a une volonté au niveau du ministère de la Santé de pouvoir en fait développer le système HMAS. Donc, on a fait une cascade de formation. Et le deuxième plan, ce sera vraiment de pouvoir identifier les indicateurs, ce sera de pouvoir les utiliser au cours des prochaines activités concernant les maladies tropicales négligées.
Thank you so much, Mao. You're talking about data and, of course, sharing of that data. I'm going to come back to you, Boubacar Diop. Hopefully, we can hear you now and the sound issues sorted out. One of the questions that I had for you, Boubacar, is that knowledge sharing is critical. And with all the wonderful work that's been going on in Senegal, how can other countries learn from your experience?
OK, merci beaucoup, Patricia. En fait, nous, au niveau pays, on a déjà développé des procédures normalisées. Et comme je le disais tantôt, il faut des documents, des outils, des procédures claires à tous les niveaux pour améliorer la chaîne d'approvisionnement des médicaments. Et comme résultat obtenu, aujourd'hui, au niveau pays, on a intégré le système classique de distribution qui part de la centrale d'achat jusqu'au niveau le plus opérationnel possible. Et en Wolof, on a un modèle qu'on appelle Yexina et qui veut dire « je suis arrivé ». Donc, je suis arrivé au dernier kilomètre. C'est une expérience vécue par le Sénégal avec des procédures, mais aussi les acteurs ont été bien formés à ces outils parce qu'il y a eu des ateliers de dissémination à tous les niveaux avec tous les responsables. Et là où peut-être le Sénégal pourra appuyer les autres pays, c'est en fait des missions pilotes d'évaluation des besoins en termes de défis, afin de proposer des plans d'amélioration à ces pays. Mais aussi, nous, au niveau pays, on a fait des publications scientifiques sur la chaîne d'approvisionnement logistique des médicaments. Et je pense que c'est des documents que les autres pays peuvent utiliser, de même que les procédures, le manuel de formation, les outils qui sont adaptés peuvent être partagés avec les pays. Et juste terminer en disant que aussi, avec les webinaires, les rencontres en ligne, l'expérience du Sénégal peut être disséminée avec tous les pays d'Afrique. Merci beaucoup. Et on s'excuse encore du réseau qui est un peu faible.
Thank you very much. Thank you. It's a good thing that we were able to hear you for that last bit. Let's quickly go to some questions. Sultani, how does WHO or each endemic country ensure supply of NTD medicines to cover the populations who are not covered by the current donation program?
Yeah, so thank you, Patricia. For us, our experience has been that the WHO consistently provides donations for specific target groups.
Okay.
But where the WHO does not provide, we have engaged different stakeholders. For example, we have even directly engaged some of the manufacturers whom we have pitched and explained our desire towards elimination. Okay. And they have come through. They have asked us, how much more do you need? And we are able to get donations from them. You know, for example, Johnson & Johnson, Merck, we are actually able to showcase and see and tell them we are going to get much better results when we target a bigger, a proportion of the community. We are also trying to get other stakeholders to come in and procure. In fact, even as government, we are also looking at how we can procure to fill in the gap so that we can take that donation that comes from WHO an extra mile to give us better results.
Okay. Modeste, how is ESPEN ensuring capacity building of staff in rural African communities on supply chain?
Thank you, Amira. I think ESPEN is doing a great job in this area. For example, working with partners to develop SOPs. And in the past, before the pandemic, we were using the supply chain technical assistance mission to support countries with bottlenecks, where we have to provide them with knowledge and understanding of the supply chain, and meeting national authorities to discuss critical challenges and providing them with recommendations. So what our plans are to continue to build capacities in terms of inventory management.
In the rural communities, right?
Please, sorry.
In the rural African communities, right?
Yeah, not really in the rural, but I think our actions can be at the national level and then drive down to the system in the rural communities.
Okay.
Yeah.
Okay.
Yeah.
All right. Boubacar, let's have you back. Are recipient countries' responsibility to waive any duties or levies on donated medicines included in any MOUs to ensure they meet this expectation? I've tried to read that as best way that actually makes sense. Did you get that, Boubacar? Are recipient countries' responsibility to waive any duties or levies on donated medicines included in any MOUs to ensure they meet this expectation? Quite a long-winded question.
Oui,
Did you get that?
En fait, au niveau, si je partage l'expérience du Sénégal, en fait, nous, on tient chaque mois des réunions de coordination mensuelles avec l'ensemble des autorités, et à ces rencontres sont conviés les autorités de la réglementation, les directeurs généraux de l'administration qui s'occupent de tout ce qui est dédouanement et titres d'exo, de même que les partenaires techniques et financiers. Donc, à ces rencontres, on discute des points relatifs à ces dédouanements de ces produits, mais en l'occurrence, l'importation de ces produits. Donc, ce qui facilite le travail au niveau pays, c'est surtout cette cadre de coordination qui est mis en place. Et dès l'instant qu'on a donné le feu vert pour l'arrivée des médicaments, on s'en occupe personnellement, le bureau que je gère au niveau du pays, avec l'ensemble des autorités pour faciliter tout ce qui est titre d'exo, tout ce qui est document d'importation. Et généralement, ça passe très vite.
Okay, okay. I think we're going to, hang on, there's just, one more question's coming in here for Sultani. It is interesting to treat through school programs. How can you strengthen school capacity and the coordination system as well?
Okay, so I didn't get the initial part of your question, but I got the part where we are talking about coordination. And yes. I think this is one
How
of
can you
the
strengthen school capacity?
School capacity. Okay, so what we have done as an NTD program, because if we achieve elimination or even sustainable control, then all the other desired outcomes are gained. So what we have done is that in our breaking transmission strategy, which is available now and has been seen by quite a number of people, we have provided for a comprehensive coordination mechanism, because you find that apart from the NTD program, which is delivering albendazole for the purpose of eliminating and controlling intestinal worms, you'll find there is the school health program, which wishes to give albendazole to improve attendance and performance. But there are other programs like even the child health program and nutrition program, which is delivering for purposes of nutrition. So we say, let us all come and sit down together within this coordination platform that we formed, so that it is the same child that we are targeting, so that we can be able to all deliver the same tablet. It doesn't mean that if I deliver albendazole, it will only target one specific outcome. But now the problem we are having is that external partners come in and they discourage some of these stakeholders from participating in this comprehensive platform, and tell them that, no, let's just create ours, which we will be able to run separately, and then they now come and take the medicines. But if we can be able to just follow the coordination mechanism that has been set, then everybody is going, actually, we will augment our achievement and we will achieve much more for everybody.
Of course, you're so right. Okay, we have to wrap there. Thank you to our implementing partners and MOH officials for providing us with in-country perspective into best practices and, of course, challenges for consideration. And again, salient participatory questions to wrap up our second segment. Let's take a moment now to see an overview of the GSK Supply Chain Forum.
Through the forum, supply chain experts work together to simplify complex challenges and to get donations where they are needed more efficiently and effectively. From manufacturing pharmaceutical ingredients to processing the finished goods, and from coordinating overseas shipments to clearing customs bottlenecks. The forum mapped global logistics capability and launched a control tower pilot program to better track and manage shipments of the drugs. Through analysis and study on the ground, the aim is to make recommendations to help streamline the distribution of multiple donations to villages, schools, and clinics. With continued commitment, we can get the job done and help transform the lives of future generations, alleviating suffering, controlling and eliminating disease, and providing hope and opportunity for millions.
Unfortunately, the sound was a bit, there's a bit of an echo there. But from what I picked up, collaboration, innovation, and compassion as the backbone of GSK supply chain operations, bringing us neatly into the topic of accessibility and how best to improve it, with collaborative support being essential in delivering the necessary medicines and innovative services to the people that need it the most. Our next panel, Panel 3, improving access to quality assured NTD health products. Hi, Lynn Choi, who's a technical officer at Medicines Assessment at WHO headquarters. You also work for WHO's pre-qualification program as an NTD focal point that facilitates access to medicines, mainly in middle and low income countries. How has this collaboration between the two departments benefited NTDs?
Thank you, Patricia. So the collaboration between pre-qualification and NTD department has increasingly driven the quality agenda in the disease programs. NTD has diverse products, but with low profit margins across 20 diseases. Access to quality assured, safe, and efficacious health product is really a key in achieving the roadmap targets. WHO pre-qualification program covers medicines, in vitro diagnostics, vaccines, and vector control products for NTD that are invited for pre-qualification when the product is either recommended in the treatment guidelines or the guideline is being developed. Mm-hmm. So the pre-qualified list published in the WHO website, it provides guidance to NTD programs, partners, NGOs, donors, and procurement agencies to select and procure quality assured products. Pre-qualification also supports NTD in quality monitoring throughout the product lifecycle by handling the complaints, investigating suspected substandard and falsified products, and publishing notice of concern. Manufacturers interested in developing NTD products also benefit from active engagement with pre-qualification. So we do support manufacturers by providing technical guidance, annual training sessions for manufacturers, making pre-submission meetings available for before the submission of the complete dossier. Specialized technical assistance, it's organized by WHO's local production and assistance unit, is also available for manufacturers for NTD priority products. And this is to develop capacity to achieve compliance with the international and WHO norms and standards. In addition, WHO pre-qualification also undertakes the risk-based assessment of products during the public health emergencies of international concerns such as Ebola, Zika, and most recently for COVID-19. The risk-based assessment is carried out also for NTD products by expert review panel, ERP, when pre-qualified or products approved by stringent regulatory authorities are not yet available. So ERP reviews data from manufacturers, and based on the degree of deficiencies, we provide advice to NTD and its partners to support decision on time-limited procurement.
Yeah. Hailen, if you could give us like one strong anecdote, one strong, point and how this has helped to provide enhanced access to health products for NTDs. And I'm sorry, I'm only asking for one. It's only because of a matter of time.
I'll be brief. Maybe I can share some numbers. So as of today, we have 9 pre-qualified medicines, albendazole, mebendazole, praziquantel, DAC, ivermectin, vaccinidazole, 5 vaccines for dengue and rabies, and over 80 pre-qualified vector control products. Since 2010, risk assessment under EIP also helped identify more than 15 products for temporary procurement while the manufacturers works towards the possible submission to PQ. And there are also several products undergoing evaluation by pre-qualification now, and we expect to see the increased number of pre-qualified products moving forward. And I believe that this will contribute to improving access to quality assured NTD products.
Well, thank you very much, Hélène. Fabienne Juberton, pharmacist at the for tuberculosis and NTDs at Médecins Sans Frontières in Geneva, in Switzerland. Fabienne, with decades of experience in pharmaceuticals for TB and NTDs, particularly in managing access to health products, how do you assess the importance of forecasting and planning for NTD products? If you could unmute.
Yes, it's better.
Okay.
Yes. Thanks, Patricia. I will switch in French. Donc à MSF, nous accordons une attention particulière à la prévision et la planification, et ceci pour plusieurs raisons. À notre niveau, nous devons déterminer quels sont les produits nécessaires en fonction des directives de traitement nationales. Nous devons en faire nos budgets pour nos besoins annuels et sécuriser nos fonds. Et nous devons nous assurer que suffisamment de produits, je parle de diagnostics et de médicaments, parviennent à temps aux patients. En général, nous n'avons pas énormément de stock et les délais avec les fabricants sont assez longs. Donc, anticiper est très important. Ce qui est également très important, c'est au niveau des fabricants. Nous avons noté qu'un certain nombre de fabricants demandent de la visibilité, de la prévisibilité dans les demandes, non seulement pour acheter leurs matières premières, mais également pour planifier leur production. Je parle ici de produits à faible volume pour certains. On a aussi des produits qui sont très saisonniers, qui correspondent à des pics épidémiques. Les fabricants ont généralement des stocks tampons limités, voire pas de stock du tout. Et parfois, et souvent, ils fabriquent à la demande. C'est surtout le cas pour les produits hors donation. Je dirais que pour les produits pour les maladies tropicales négligées en général, ils représentent un marché qui est peu rentable, avec peu d'incitation pour investir davantage. On a un nombre de fabricants qui est très limité. Et donc, on doit être extrêmement prudent dans notre démarche. Et donc, un bon prévisionnel et une planification sont essentiels pour la prise en charge des patients.
Fabienne, how is MSF supporting WHO in ensuring that NTD medicines reach those who need the most?
MSF, nous sommes une grande organisation. Nous avons 3 centres d'approvisionnement en Europe, 5 sections opérationnelles. Et donc, on a plusieurs projets à travers le monde. Et nous intervenons très souvent dans des milieux ruraux qui sont reculés, où les ressources sont rares et les systèmes de santé fragiles. Nous avons nos propres projets, mais nous aidons parfois les autorités locales à pallier à des pénuries chroniques, notamment pour des produits qui ne font pas l'objet de donations. Nous fournissons toujours des produits de fabricants qui peuvent nous garantir des normes minimales de qualité, et nous appuyons sur la préqualification de l'OMS, comme vient de l'expliquer Aileen, ma collègue de l'OMS. Et la qualité est un élément important chez MSF. Nous avons une politique d'assurance qualité qui est très stricte sur les produits que nous pouvons fournir dans tous les programmes en général, pas seulement pour les maladies tropicales négligées. Dans le cadre de notre collaboration avec l'OMS, nous faisons partie d'un comité directeur des achats pour la leishmaniose, par exemple. La leishmaniose, c'est à peu près 6 produits, dont un seul fait partie d'un programme de donation. Et dans le cadre de cette initiative, nous évaluons la situation du marché, les interventions possibles. Nous essayons de mutualiser nos demandes lorsque c'est nécessaire, par exemple pour atteindre un certain volume de commandes. Et nous partageons globalement nos expériences et défis. Nous discutons également de la manière d'augmenter le nombre de fournisseurs. Pour certains, beaucoup de produits, nous avons un seul fournisseur au niveau mondial. MSF, nous avons également la gestion du stock d'urgence de l'OMS pour les produits contre la leishmaniose et également nous gérons les stocks pour les produits pour la maladie du sommeil. Nous avons des accords contractuels avec l'OMS pour gérer ces stocks. Donc, je dirais qu'en résumé, il y a très peu d'acteurs qui sont présents pour les maladies tropicales négligées et MSF, ça fait plusieurs années qu'on milite pour un meilleur accès aux diagnostics et aux médicaments, en réduisant notamment les barrières financières pour tous les produits qui ne font pas l'objet de donations. Ces maladies touchent une population très pauvre et les financements sont assez limités. Et la collaboration avec les autres parties prenantes, l'OMS, mais tous les acteurs en fait, qui travaillent dans ces programmes est importante quand on doit mettre réellement nos ressources en commun.
That's correct. That's correct. Penny, I'm going to turn to you. You are a senior advisor for infectious diseases in the NTD's division at USAID in Washington, D.C. Prior to joining USAID, you spent years working in countries that have weak health systems. And this exposure must have been invaluable in terms of insights to your current work, supporting NTD management of medicines in countries supported by USAID. Briefly tell us how this has influenced you.
Thanks, Patricia, for the question. Many countries, unfortunately, are donor dependent for their health systems, and this can present a lot of challenges as many donors supporting health systems, including drug management, frequently have strict requirements on processes, staffing, systems, and thus can be perceived as owning or managing the programs. USAID in our NTD division is working hard to promote greater host country government ownership of their NTD programs, other health systems, excuse me. A key approach that we've successfully used is what's called a fixed amount award, or a FA. This is a milestone-based funding mechanism that gives countries more autonomy in decision-making and management of their programmatic funding, and with specific targets to be reached in order to receive incremental funding. In many of our supported countries, the FA approach has been expanded to specifically target drug management, which has helped countries to better prioritize first expiry, first out, getting the right quantities to the right distribution sites on time, and reverse logistics, among other things, which is resulting in higher treatment coverage as well as reductions in the numbers of expired and wasted drugs. By helping them identify and implement more effective management processes, we're working to support countries to increase their capacity, their autonomy, as well as their accountability for their donated drugs.
Brilliant. Bring us up to speed on what USAID's approaches are to promote availability and access to high quality NTD medicines.
Sure. We're doing a number of things, but one of our proudest partnerships is with the U.S. Pharmacopeal Convention on a project called Promoting the Quality of Medicines Project, and its follow-on, what's called PQM+, where we've been working with them since 2014 in response to WHO's call for expressions of interest to increase the global supply of quality assured NTD products. This partnership provides technical support to existing generic manufacturers of 8 PCT NTD products, both the API and the finished pharmaceutical product, to ensure that there's an available supply of quality assured essential medicine products for procurement, particularly for populations that are not eligible for donations via the WHO donation program. This multi-year process involves reviews of current manufacturing processes, creation of corrective and preventive action plans, mock audits, as well as partial financial support for bioequivalence studies as part of the manufacturer's dossier submission to WHO's pre-qualification program that Highland talked about. Some additional areas that PQM Plus has been working on for the larger NTD drug community include landscape analyses of NTD drug manufacturers in Africa and Asia to expand the geographical base of quality drug manufacturers, creation of a good manufacturing practice e-learning training course, which has 10 modules on elements of quality assurance, from auditing to water systems. And individuals can take one or all of the modules for a certification. And we're encouraging manufacturing staff from senior management all the way down to floor staff to enroll and take these courses for both their professional and institutional development. And to date, we've had over 15,000 enrollments. I can paste the link to the site into the chat for anyone interested.
Please do.
And then lastly, I just want to talk about something new that PQM Plus is working on creating now, is a global medicine information dashboard for NTD APIs and finished products. This tool hopefully will consolidate available information on existing NTD medicines, their good manufacturing practice and pre-qualification status where known, to help procuring agencies, national medicine regulatory authorities, health professionals, manufacturers, suppliers, donor communities, and anybody else who's interested to know what's out there and where to find it. And we're hoping to launch this tool in the next quarter.
Fantastic. Looking forward to that. Thank you, Penny.
Sure.
Laurent Fraise, Director for Research and Development, Drugs for Neglected Tropical Diseases Initiative in Geneva, Switzerland. DNDi continues to be an active contributor in developing treatments for neglected populations. Could you describe for us what DNDi's current portfolio of projects is for NTDs? We can't hear you. Could you put your mic on? Thanks, Laurent.
Thank you. Thank you.
There we go. We can hear you now.
To discuss a bit the NDI contribution to NTD, and maybe also discuss about potential future access needs if we succeed in delivering treatments.
If we have a little bit more time, yes.
Yeah, exactly. So
go ahead, Laurent.
As a mission, the NDI, as you know, is to discover, develop, and accelerate access to urgently needed treatment for neglected patients, with a focus on gaps for neglected tropical disease and viral diseases. So today, a few information with regard to our neglected disease portfolio. So maybe from an historical point of view, the first disease that the NDI was working on was on sleeping sickness, with the delivery of fexinidazole for TB, Ganzianse, and nifurtimox eftanitine as an injectable treatment. But we are close to delivering phase 3 data on the use of fexinidazole for TB rhodesiense. In that case, from our point of view, this would be a major breakthrough because this would avoid the use of melarsoprol. That is a very toxic drug for patients. We are also close to publish the data on acoziborol, a very simple treatment, a one-day treatment for sleeping sickness. And this drug has also the, I would say, properties to think about elimination and use for elimination of sleeping sickness. So a very important drug as well. The second disease is visceral and cutaneous leishmaniasis. So we have an intense activity of developing solution by combining existing drugs. Maybe the next to come is data on the combination of metefosine, paromomycin in East Africa that we expect to be very positive to replace antimonials in the treatment. But also coming from our discovery activity and our partner, a new generation of oral new chemical entities, new drugs that could be used as single drugs or in combination. And we are very glad to have the first one entering into proof of concept in India in partnership with our partner Novartis. The third disease is about Chagas disease. We are really, I would say, committed to find new, shorter and safer treatment with benznidazole as a first step. But here again, like visceral leishmaniasis, we have a series of drugs, new chemical entities coming from our discovery activities that are currently into phase 1 to provide a new generation of solutions. Fourth disease in which we are involved on filariasis and cocercasis with a new generation of drugs at phase 2, proof of concept stage. And here the principle is to try to kill adult worms and move, I would say, from a mass drug administration into a test and treat and test and cure paradigm. by combining those new drugs, possibly with ivermectin, and have a curative regimen for filariasis. And last disease in which we are involved on is mycetoma, with the evaluation of phosphaticonazole, a nasal drug, to treat certain form of mycetoma in Sudan, hoping to deliver also positive results next year.
Okay. Now, developing new formulations and medicines for NTDs is great, but this takes time. How do you ensure populations have access to treatment while you're still in development phase?
So, in fact, we clearly, historically, the NTD has been designed as an experiment in innovation for access. So, access is completely integrated into our development process. Okay. And the first step maybe is to consider that for many of those negative diseases, we are working very closely with endemic countries, and we set up clinical research platforms that in fact are already treating many patients already. And of course, we will leverage those networks and those platforms when the drug will be registered to provide access to the treatment. But more generally, we ask our teams very early in development to ask them about 4 questions. So demand, we need to have someone who can prescribe the drug. And of course, this is connected to diagnosis availability, which is a major piece of access as well. Supply, so someone needs to bring the drug to the patient, and we know that we are often facing with a lack of return of investment, and we need to design new models for supply and think about interaction with private partner early in development to ensure this supply. And of course, financing, the cost should be covered in one way or the other. And we are designing financing system when the drug are at the level of phase 3 in order to ensure that we have a solution when the drug is registered.
Of course. Okay, let's get to some questions here. Now, Hailen, one for you. What are the challenges you experienced with pre-qualification for NTD products?
So one of the challenges is really the lack of visibility of demand, which often leads to the low interest from manufacturers in investing in improving quality and applying for pre-qualification program, which also involves the fee. So NTD products have small and fragmented market, but manufacturers will still need to have a better understanding of the demand and the market. So NTD, together with pre-qualification, we try to work with partners to carry out forecasts. And one of the example is the global forecasting exercise done for leishmaniasis products. As also Fabian mentioned before, by all relevant partners. And I believe that we should replicate this model for also other NTD products to have a reliable forecast to share with the manufacturers and coordinate the supply. And that will also help attract potential other manufacturers to enter into the NTD market.
Thank you very much, Hailen. There are lots of questions coming in, but this is one that can go to Fabien, Penny, or Laurent. And if you could all speak to this, that would be great in the next 3-4 minutes that we have left. What do you think is needed to have better coordination among partners to improve access to quality assured products? Who would like to start us off there?
Maybe on my side, 2 comments. So partnership, early in development from our point of view matters a lot. And also thinking about quality and sustainability, we are very, I would say, convinced that local manufacturing is a solution to ensure long-term sustainability and also quality improvement in I would say, low and medium income countries, in order to avoid the system of stock issues, lack of access to drugs for a certain period. So local manufacturers are very important to us, and we plan to integrate them as much as we can in the future.
Okay. Somebody's just mentioned that my audio was not good. Perhaps you didn't hear the question. I'll just put that out, even though Laurent, you answered perfectly. What do you think is needed to have better coordination among partners to improve access to quality assured products? That's to Fabienne, Penny, and of course, Laurent as well, who's just spoken to that. Penny, Fabienne, would you like to add something to that?
I'll take a stab at it. It's a challenging question for sure, and we're incredibly grateful for the existence of the Global Donation Program, but we do need to recognize too that not all target audiences can be reached, and so ensuring that there's availability of supply, but that it's at a reasonable cost. This is a big factor that we're wrestling with now as we're working with countries towards sustainability of their long-term programs post elimination of the targeted diseases, thinking about making sure that they're able to procure drugs when and if a donation program is not available, and that it is also at a reasonable price. And as we know from so many other health sectors, particularly malaria, there is so much out there that is of questionable quality, but that is very, very cheap. And so working with countries to ensure that they build in enough resources to both ensure that they're buying quality assured drug and that they understand the value of that versus going with whatever the cheapest product is out there. And so encouraging other procuring agencies who may be buying drugs to go for only quality assured products will help send a message to governments and other smaller procuring agencies that they should also be buying this higher quality product, that it's in their best interest long term. How we can better coordinate that, I think that's something to wrestle with, and we're still figuring that out. But it's definitely a good question and one that we'll be thinking about for the next few years for sure.
Great. Fabienne, anything more to add there?
Oh, I have very few to add, Penny, or summarize perfectly. I think the coordination is key because we have seen for many drugs and for a certain number of diseases, we have a very fragmented market. So I think it's very important to bring all together the resource that we have, a common approach, and we know that this is not by chance that is called neglected disease. So we need attract more funders. We need to attract more suppliers because we have a very few manufacturers, and we don't want them to leave the market. And it may happen. We have already one example for diagnostic. So it's the coordination among ourselves, and we try to speak each other to have this coordinating mechanism. But I have to say that we're struggling quite a lot. So we need to, and also at the country level, we need to have the program to understand that, for instance, and it was mentioned by, I don't remember, someone from Kenya or Senegal, we need to have a good data. We need to have a good reporting system so we understand the extent of the problem, and we can have a good forecast. We can speak with the suppliers and have a more powerful approach.
Thank you so much. There's been so much invaluable information shared today. It's a huge topic with so many moving parts that need flexibility, from dedicated and knowledgeable teams to navigate numerous requirements and ensure the right control mechanisms are in place. We've heard about the specific need for expert coordination. That question at the end there, really calling for another webinar. We've heard about support, accountability, commitment, and how essential that is at all levels of operation to provide an effective backbone in delivering the NTD roadmap targets and vision. I'd like to thank all our esteemed panelists for their contribution, as well as the audience for enriching the discussion further. On behalf of the entire NTD team who have helped make this event possible, enjoy the rest of your day. Thank you.
ไปหาอื่น
ของใครใจสุดตรงที่สิเฝ้าคอยหาเนื้อทองไม่มา